The one time that it makes the most sense to go actually get x-rayed is if you suspect that you potentially have a fracture. Now, fractures with ankle sprains are actually extremely rare. They occur in about 15% of ankle sprains according to statistical research, meaning that of the people that actually go in to get their ankle sprain diagnosed, about 15% of those include fractures. Now, there's probably a whole bunch of ankle sprains that occur that never get diagnosed or treated formally, so those can stay outside of that statistical analysis. So really the number is probably quite a bit lower than that. There are 4 quick screens that you can do on yourself. They're called the Ottawa ankle rules to determine if you may or may not have a fracture in your ankle. Now, number 1 is it's just a test to see if you can walk and bear weight on that ankle. Now, if you're limping, that's okay. As long as you can put some pressure on your ankle, even if it's painful, that's a sign that you probably don't have a fracture. Now, the second test is to palpate the malleoli, they're called. Those are those 2 ankle bumps, people call them, on the outsides and insides of the ankle. And you palpate the lateral malleolus, it's called, on the very bottom tip. And then you palpate the medial malleolus on the back side near the bottom of the bone for pain. Now, it's not uncommon to have some tenderness in these areas with an ankle sprain, but if you have exquisite tenderness where you want to pull away from that palpation, that's a sign that maybe you have a fracture and it could warrant getting an x-ray. The other 2 places to palpate are called the navicular bone, which is a bone on the inside of your foot, just past your ankle, seen right here. And the last place to palpate is on the outside of your foot on what's called the 5th metatarsal head, or that little bump on the outside of your foot that you can feel if you push in or slide your finger along the outside of your foot. If you have exquisite pain in any of those areas, it may require you to get an x-ray to determine whether or not you have a fracture in one of those spots in conjunction with your ankle sprain. If all of those tests are negative and you can bear weight even if it's a limp, you probably don't have a fracture and can go directly to your physical therapist and begin the rehab process immediately so that you can get on the road to recovery as fast as possible.